Next is ureter. Ureter it has different parts: abdominal ureter, pelvic ureter, and intravesical portion. So abdominal ureter, it lies on the medial edge of psoas major muscle, and it enters into the pelvis at the bifurcation of common iliac artery in front of sacroiliac joint. So we have abdominal aorta, it's common iliac artery. Then we have kidney, we have right and left ureter. So at the bifurcation of common iliac artery. So the ureter will enter at this point at the bifurcation of common iliac artery in front of sacroiliac joint. So this is another image which is helpful to understand. Let me label it. So this is common iliac artery, and then it's bifurcation. You can see this branch and this branch, and then ureter is passing that. So again, abdominal ureter lies on the medial edge of psoas major muscle and then cross into the pelvis at the bifurcation of common iliac artery. Right ureter at its origin is covered by second portion of duodenum. So you can say this is the second portion of duodenum. We are talking about right ureter. And one thing I will tell you that ureter is one of the topic is very important, and then you will forget the relationship of the ureter. You can keep it in the end. Review it before you go for the exam, because they will most likely, definitely they will ask you a question from the relationship of ureter. So if you look at the anatomy, if you know the anatomy, then you can remember the relationship. If you don't know the anatomy, if you don't have any image in your mind, you will forget it. So right ureter at its origin is covered by a second portion of the duodenum, and it is lateral to inferior vena cava. So I will draw. So inferior vena cava is lateral. So it is crossed by, right ureter is crossed by gonadal vessel. Gonadal vessel is testicular or ovarian artery, and it is also crossed by right colic and ileocolic vessel. So everything is here. Let me show you. So what they're talking about is right ureter is crossed by right colic vessel here, ileocolic vessel, which is the second branch here, gonadal vessel, which is this. Just remember three vessels. It's crossed by testicular ovarian artery, which is gonadal vessels, and then right colic and ileocolic vessel, right ureter. So if we go over relationship of ureter again, at its origin, it is covered by duodenum. It is present lateral to inferior vena cava, and then it crosses common iliac artery at its bifurcation, and it also crosses right colic vessel, ileocolic vessel, right gonadal vessel. And if you can see that the right ureter is running behind these vessels. Now, if we talk about left ureter, again, left ureter is also crossed by left-sided gonadal vessel, testicular and ovarian vessel. This also crossed by left colic vessel. This one, sigmoidal vessels too. Same thing, 3 vessels. Left ureter is also, when crossed by, it means I'm saying it's running behind those vessels, left colic vessel, sigmoidal vessels, left gonadal vessel, that is testicular and ovarian vessel.